Our country continues to face very serious and worsening challenges under the current administration. There is an education crisis in this country. Our education is being disrupted because government capitation funds are not reaching schools on time. We are disrupting learning and jeopardizing the future of our children. It is deeply concerning that while funds are allocated for renovating State House, such as 2.3 billion allocated for this financial year's budget, money is being promptly provided for renovation of State House, but essential education funding is getting delayed, and this is totally unacceptable. Healthcare systems breakdown. The health sector is equally under siege. Over 8,500 workers, healthcare providers, are currently on strike. Just yesterday, we witnessed a very dehumanizing case in Egagania Hospital in Gatundu North constituency of Kiambu County, where a father was mourning the loss of an infant in his hands, allegedly because there was no healthcare providers and doctors to attend to the very needy infant who eventually succumbed. It is very painful to note that those very many incidences are happening not only in Kiambu County, but in all counties in this country, because health crisis has been devolved. It is unfortunate that we are not devolving market constructions where money is. We are holding tightly on construction of market as national government, but when we are not able to sort out the health crisis in this country, we devolved problems to the counties. I am not here to defend county governors and administrators, but I am here to highlight that there is a serious problem in our health sector. We cannot assume that life is okay and it's normal to continue with life when over 8,500 health care workers are on strike. Critical vaccines such as BCG and polio are in short supply across public hospitals. Parents of newborns are now being forced to turn to private facilities where polio vaccines cost between 10,000 and 15,000, amount many cannot afford to pay. We have misplaced priorities and political gimmicks. Instead of addressing this very urgent crisis, the Deputy President and several Mount Kenya and MPs of their National Assembly, and this has largely been concentrated in Mount Kenya, but it has been seen in other counties like BC, MPs are busy holding political rallies in the name of economic empowerment forums, and they continue to distribute handouts across the region. Yet, babies born in those areas where these handouts are being distributed cannot afford the BCG and polio vaccines. It's very unfortunate. Meanwhile, President Ruto continues to expand his advisory team. Now he retains over 20 advisors who continue to consume more than 1 billion shillings of public funds annually. Yet we cannot afford to bail out our newborns. We cannot afford to acquire BCG and polio, yet we can afford to maintain these advisors at this alarming level.